Dr. Bordeaux, what are you worried about in terms of the challenges for this vaccine?
Right. So, the distribution continues to really, really worry me. And it's sort of two fronts or three fronts. I mean, the first is just the logistics. Who and how is this going to work? And I think, one of the concerns with this was, the temperatures that it was going to have to be kept at. Now, the Moderna vaccine, one of them seems to have solved that problem, maybe, and that's really exciting news. Um, but so that's one. Two is really the public conversation around prioritization, and here is where I think I'm very concerned because there are many, many, many ways in which people lose out, and communities that have really suffered in this pandemic, and historically marginalized communities. I'm just very worried about how the conversations are going to go, and who's going to get access and how that conversation is even going to be held. And I think that worries me. And then the third is, of course, the issues around vaccine hesitancy, misinformation, disinformation. And that's a more vanilla routine kind of concern with any public health initiative. But also, how will this play into our overall conversations around public health? I mean, we need to never walk away from the fact that our public health system is it really depleted, and we need to really dig in here and rebuild it. And the vaccine shouldn't be the thing we say, oh, we're not going to do that work because now we have a vaccine. It's how do we build a robust public health system that underwrites human security both in this country and in the around the world, and vaccines are just one
Yep.
really important but one piece.
I think that's right, and I think I want to just start from the good news. We've been doing this for a couple months now, and there were times when our segments were were hard to find a way out of. So this is really exciting. This is the end game that we always knew would help us, but it wasn't going to be a cure-all, and that there would be systemic global health issues even after we conquered COVID. But it is time to be thankful. This is what it's Thanksgiving. We should be thankful. But we are in the middle of the worst period we could imagine, worse than March, worse than late spring, because we are now in a pandemic that has no epicenter. This is truly a 50-state disaster. Every state but one or two are in the red. And we are in the middle of a transition that President Trump is not making easy in terms of information flow. I worry less about the public health and global health sides of information sharing between the Trump team and the Biden team, because the Biden team is so smart, and already gets it and probably gets it better. Like, what are you going to learn from some of those people on the task force who are like denying masking, right? My worry is the supply chain side. Is, do we have transparency on what to anticipate, what may come down the pike, and what we should be ordering now, right? Because it's going to get worse in January, February. That's clearly not going on. So we're just going to be 2 months behind.
One thing I would like to reiterate is what the public health strategy needs to be. Again, there's three legs of the stool, because for me, there's masking and social distancing measures and the staying away if you at all can. There's another piece, though, which really is focusing in on our buildings and our ventilation and our air filtration. Now, that's not an individual's necessarily their job, but you might want to take that up with the school board, and other essential workplaces. I mean, we can make some changes to the indoor environments which we find ourselves this season, if we work together, and that will offer some real protection to people. And then the third thing, always, is that contact tracing. I know that many states have not even stood up even a beginning program around contact tracing, but many have, and that's awesome. And there's no time like the present to start. So those three things, right? The individual behaviors, the environmental modification, the contact tracing. If we do those things as best as we can, we really will save lives. I mean, possibly hundreds of thousands. So let's not give up. Let's make those investments and call on our leaders to make those investments.
So since Biden has won, we have governors who do not view this as a litmus test or a fidelity test to their party. And so we've seen 5 or 6 Republican governors move towards masking, aggressive masking. They're not perfect mandates. And that sets a floor for their states. That's important. You can look at all the loopholes, but it's important for a governor to come out pro-masking. And I think other Republican governors will follow suit. So that there's a change before Biden is even president, that is the power of not politicizing public health. So I'm going to look for good news where I can this winter, and that's a piece of it.
We wish you and all of your families the best of health. Happy Thanksgiving, and thank you. See you soon.
Happy Thanksgiving.